It's really my pleasure to introduce Henry Winkler. He really doesn't need any introduction, but I think I've gotten to know him over the last couple of years. We've done several interviews together, and he is truly passionate about getting the word out about upper limb spasticity.
So my mom, 1989, had a stroke, and she did her therapy, and she went every day to the hospital, and eventually came home and started to have her upper limb just seize up on her. And all of a sudden she had upper limb spasticity. But at that time, there was not a lot to deal with upper limb spasticity. So I watched my mother, who was a very active woman, who was part of the Judaica shop at our temple, who had her bridge games, who had her friends, who had her children, who worked at the PTA. I watched her life come to a grinding halt. Not only because she had a stroke, but because of all the work she was doing didn't seem to bring her any more far forward, any further forward. And there is now this extraordinary work that is done, the extraordinary knowledge now about what it is to have a stroke, where that is no longer the case. And then I was asked, and I became the spokesperson for this therapeutic use of Botox for upper limb spasticity. And I know for a fact, if my mother knew that this existed, if she was able to have the incredible sometime result of this therapeutic use of Botox, it would have changed her life.
Is we really like to individualize the therapies. So we come in and we evaluate the patient. So we work on the doses of different drugs, either the injections or oral medications. We talk about therapy. We send a lot of patients back to therapy after they get treatment, and we talk about the expectations of the caregivers. We have a lot of research trials now and upcoming in spasticity, and we have a multidisciplinary clinic who I see a lot of familiar faces, so I think that many of you have been through that clinic and are aware of all the things we offer. So we try to design things to be very patient-oriented and to be outcomes-oriented so that we can give you some goals and set those as a goal for improvement.